Perfect. Good afternoon. My name is Neil Gerts. I'm a internal medicine resident physician at Los Robles Medical Center in Thousand Oaks, California. I'm here to present COVID-19 infection and the surprise Guillain Barre syndrome diagnosis. As we all know, COVID-19 has been a big part of our everyday lives ever since 2020, and we're all every day experiencing new adverse side effects of COVID-19. Recently, I and a lot of physicians have been seeing associated neurological symptoms with Guillain Barre syndrome, with COVID-19. And this has prompted me to do this presentation on a Guillain Barre infection in the setting of acute COVID-19. Guillain Barre, as we know, is an acute autoinflammatory disorder, autoimmune disorder, when the body attacks its own peripheral nervous system and a process called molecular mimicry. So here I present a case in the workup associated with Guillain Barre in the setting of COVID-19. So pretty much, I first present a 39-year-old male. He really had only a past medical history of chronic back pain for approximately 2 years and presented with a chief complaint of bilateral lower extremity paralysis, left eye proptosis, which began the day prior to his presentation. Pretty much 2 days prior, he woke up with these symptoms, had bilateral lower extremity numbness from the waist all the way down to his lower extremities, had 102-degree fever, and had a headache, along with inability to walk. He decided to sleep it off, see if it will get better, and the following day, it actually just got worse. He then noticed a bilateral hand numbness, along with blurry vision, along with worsening proptosis of his left eye, which led him to come to our emergency room. I would just like to make of note statement that he had no recent IV drug use, no recent vaccinations, and no sick contacts. And he also had no diarrhea as well. On my initial physical exam, I did notice, starting from the top, that he did have significant left eye proptosis, along with decreased wrinkles on the left side of his forehead. He did have hand numbness and was not able to have any sensation on his bilateral palmar surfaces. Also, extremely pertinently, he had 0 out of 5 reflexes on his lower extremities, and complete numbness going from his waist down to his toes bilaterally. His strength was intact, but he did have complete numbness. Had really difficulty walking. Regarding his laboratory, his CBC, CMP were unremarkable. His ESR was minorly elevated at 25. CRP was 9.7, and he was incidentally found to be COVID-19 positive. His vital signs were stable. He did not require any oxygen on the initial presentation. So regarding our workup, what we originally did is we first did a full CT of the head and spinal cord. They were all negative. We then proceeded to do an MRI with and without contrast, which were negative as well for any nerve compression. And as a result, we proceeded to do a lumbar puncture. I put the data on the lumbar puncture below, but everything was unremarkable except the elevated total protein, which is found to be 159. The gram stain, the CSF, CSF culture, and blood cultures were all negative for any growth. Due to the elevated protein stain at 159, we had a concern for Guillain Barre syndrome. We consulted neurology, and we decided to begin the patient on a course of IVIG treatment, immunoglobulin treatment for a 5-day course. Throughout his hospital course of receiving the treatment, he did not require any supplemental oxygen, so no COVID-19 treatment was started. After receiving only a 5-day course of IVIG, the patient endorsed complete resolution of the symptoms. He was able to walk, stand without assistance, and had 100% improvement in his bilateral lower extremity numbness, and his blurry vision and numbness in his hands completely resolved as well. So I would like to point attention to the association between Guillain Barre syndrome and COVID-19 infection. As previously said, COVID-19 is going to be a huge part of our everyday lives going forward. Guillain Barre syndrome was previously associated with respiratory and gastrointestinal infections, not priorly thought to be associated with COVID-19. COVID-19, as we know, is a respiratory infection. So physicians all across the world should be aware of the association between Guillain Barre and COVID-19. The treatment is also important to know. It is recommended to also treat the underlying cause. In this case, it was COVID-19, as the patient did not require any oxygen. No treatment for COVID-19 was initiated. Due to the fact that he did have elevated proteins, we were able to diagnose Guillain Barre syndrome. It's called cytologic dissociation. We started the treatment patient on IVIG, but either plasmapheresis or IVIG can be used. In this case, it was easier for our institution to use IVIG, and the patient had significant improvement in resolution of his symptoms. So just given the overall fact that COVID-19 continues to be a part of our everyday lives, it is important for physicians to be well aware of the associated treatment of association of Guillain Barre syndrome and the treatment. And my references are also on the bottom. And if anyone has any questions.